Now, there's a concept where you basically practice um, moving your hand all over again. This is after you have had a shoulder dislocation. They have done a surgery. So when they do a surgery, most of the times they use a sling and they tie it, from your hand to the neck. So just to make sure that your hand is not moving too much so that you can have time to heal very well. You understand? So most of the times it takes about 4 to 6 weeks, you know. So it takes a lot of time. So uh, so sometimes you miss out, on how to actually, you know, be moving your hand. So it's good for you to practice that, you know. So what we have here is this, you know. So these are the various ways in which uh, the patients can be able to practice back, you know, moving their arm again. So after shoulder surgery, early movement of the elbow is very important, and early movement of the wrist and the fingers too is very important. So it's strongly encouraged so that it will prevent stiffness and to maintain the blood circulation, right? So what are the reasons? If the patient keeping their hand in one place for a very long time, it leads to what? Stiffness, right? Also, you are doing this to maintain the blood flow. So gentle movement reduce swelling and improve healing. It also preserves the muscle activity. So it keeps the forearm and the hand muscles active while the shoulder rests. You know. Okay. So typical early exercises include, okay, they are done gently. So you have elbow flexion and extension, forearm rotation where you turn the palm up, okay, then finger movement, okay, then grip strengthening where they give the patient a ball to be squeezing, or they can be rolling their toe lightly just to maintain the hand movement because it's serious. After some time you could actually end up forgetting those movements. So precautions now: avoid lifting or pushing with operated arm until cleared by the surgeon. So the shoulder itself should remain immobilized. So the main movement should be actually around your hand, you know. Then always follow the rehabilitation protocol provided by the orthopedic team. What they tell you to do is you always do it, okay? So this is what we have for this